What is prosthetic artery embolization and when is it needed?
Prosthetic artery embolization is a rapidly emerging, minimally invasive image-guided therapy where we use the femoral or radial axis to enter into the prosthetic circulation using microcatheters, and we embolize the prosthetic artery selectively. So this is indicated in medically refractory lower urinary tract symptoms secondary to benign prostatic hyperplasia. So usually we recommend the therapy for patients who have at least tried 6 months of medical therapy and have been refractory to it. It is also indicated in patients who want to avoid surgery like TURP, which is commonly practiced for BPH, or in patients that are extremely morbid to undergo surgery, and in patients that would not be where we cannot withhold anticoagulation, especially.
Why is prosthetic artery embolization better than the conventional modality of management?
The gold standard in current management of BPH for a long time has been transurethral resection of prostate, or TURP. When it comes to prosthetic artery embolization, as opposed to TURP, which requires about 1 to 2 days of hospital stay, most times, we can discharge the patient the same day. In majority of the cases, maybe in 90 to 95% of the patients, we're able to send them back the same day without an indwelling Foley's catheter, which is usually removed post-procedurally. And the recovery time is often less than 5 days. It takes less than 5 days for the patient to get back to complete normal activity after PAE, as opposed to about 2 weeks recovery that could be needed in TURP.
What is radial approach of this procedure and how does that benefit the patient?
Conventionally, PAE began as a transfemoral axis procedure, but in the last 5 years, a lot of Western practice has evolved towards a transradial axis with the availability of newer catheters, which are often much longer than that were conventionally available. But with the availability of newer catheters, especially from Thermo, we are now getting catheters in the length of 120, 130 centimeters. And therefore, we're able to access the prostate relatively easily from the radial axis.
What is your message to the general physicians who would finally manage this patient in their OPD after the procedure has been done by an interventional radiologist?
One of the most common complications that can occur after PAE is post-embolization syndrome. So where due to the ischemia that is induced in the prostate, the patient can have an inflammatory response, which can last from a week to 2 weeks. We usually prescribe a short course of NSAIDs to minimize the incidence of post-embolization syndrome, but still there can be some breakthrough episodes of fever, weakness that can be managed using symptomatic treatment. And the other complication that we usually watch for is urinary tract infections that are uncommon but can occur in these patients, and we usually recommend a course of antibiotics to control the UTI.